What are the different treatments for hooded eyelids?
Hooded eyes can be caused by redundant eyelid skin, drooping brows, or a combination of both. I'll address how I treat hooded eyes every day in my practice with non-surgical and surgical options. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. As an oculoplastic surgeon, I can attest to the value of training in ophthalmology or eye surgery, followed by specialized training of the areas around the eyes. Proper diagnosis of the different anatomic causes of hooded eyes as it relates to the eyes is very important. Additionally, understanding the potential impact on eye health from any procedure performed around the eyes is critical. Throughout my career, there have been remarkable innovations with neurotoxins, fillers, and surgical procedures. I routinely incorporate these advances to create customized strategies for my patients. It is very important to properly analyze the causes of upper eyelid hooding. The appearance of excess skin partially covering the eyes can often mask the presence of other conditions which cause the eyelids to droop, such as eyelid ptosis. Eyelid ptosis is a condition where the margin of the eyelid is lower than it would normally be for that individual. Eyelid ptosis is generally caused by issues affecting the muscle responsible for lifting the eyelids called the levator muscle. Not recognizing the presence of ptosis can result in disappointment in the outcome of procedures where only the skin is addressed. The brows play an important role when it comes to managing hooded eyes. An observation I've made over the course of my career is how impactful the appearance of the brows have on facial expression. If you draw a cartoon and you want to show happiness, anger, or surprise, you can do that easily with drawing the brows in different ways to show those emotions. Many times patients tell me how they are afraid of looking always surprised after a brow procedure because of people they've seen who they say had too much Botox or too much surgery. I look at brow enhancement as an opportunity to artistically shape the brows rather than just lift them. In many situations, eyelid hooding can be improved by addressing the brows with the procedure called the Botox brow lift. This is done by using Botox or a similar neurotoxin such as Dysport or Xeomin. The neurotoxin works by relaxing the depressor muscles in the brow area that push the brows down. By relaxing the depressor muscles, which include the corrugator procerus and orbicularis oculi muscles, the muscle which raises the brows, called the frontalis muscle, works unopposed, thereby allowing lifting of the brows. As is the case with any neurotoxin treatment, the results can last 3 to 6 months and the procedure needs to be then repeated. Another non-surgical approach to brow lifting and shaping to improve hooded eyes is a technique where injectable fillers are placed to restore volume which is lost caused by bone loss as well as loss of fat and soft tissue. I often place the filler in the temples and the strategic areas of the outer aspects of the brows, which through volume correction helps to create a better looking brow shape. When brows descend to a point where neurotoxin and fillers are not going to be enough, surgical options are then considered. Although I perform all types of brow lifting surgery, including coronal, endoscopic, and trichophytic brow lifts, I have found myself being more inclined to performing more conservative skin-based procedures for artistic shaping as opposed to what I was more inclined to do in the past, which was geared more towards lifting. The coronal brow lift has fallen out of favor amongst most cosmetic surgeons, but can still be used in certain patients. The procedure is done with a single long incision made from behind the hairline for the purpose of excising excess skin and address specific muscles. Another brow lifting technique is the endoscopic brow lift. This involves small incisions made behind the hairline. A camera called an endoscope is used to see the areas to be operated on from these small incisions. An example of a brow lift which is done only at the skin level is the trichophytic brow lift. This procedure is performed from behind and within the hairline. An advantage of this technique is that it allows hair to grow through the incision for better camouflaging. Variations of this method can be employed for brow shaping, which can be performed from naturally existing forehead lines and even directly at the border of the eyebrow hairs. When there is upper eyelid hooding, there is often excess skin and soft tissue. In these situations, cosmetic upper eyelid surgery, also known as upper eyelid blepharoplasty, is the most direct procedure to addressing eyelid hooding. This is a surgical procedure where redundant eyelid skin, known as dermatochalasis, is carefully measured, excised, and sutured to define the upper eyelids. My goal is not to remove as much skin as possible, but rather to reveal the true shape of the eyes. The artistry needed in performing upper eyelid blepharoplasty to appear natural for the individual, whether they're male, female, younger, middle-aged, or older, and factoring ethnic specific characteristics cannot be overstated. Both surgical brow shaping and upper eyelid blepharoplasty is performed under local anesthesia with light sedation, avoiding issues related to general anesthesia. Patients undergoing either or both surgical brow shaping and upper eyelid blepharoplasty typically return to work in 1 week with minimal bruising and swelling. Approaching the management of upper eyelid hooding depends on proper evaluation of the extent of the hooding, the possibility of coexisting eyelid ptosis, and concurrent issues within the eyebrows. In my practice, I help my patients make informed decisions based on the specific factors which contribute to the appearance of their hooded eyes. Being satisfied with the outcomes of any procedure or procedures is more likely when you understand the diagnosis, the treatment strategy, and what you should expect afterwards. I hope you found this information helpful. Thank you for your question.